Thank you very much. Good afternoon, everyone. I hope people are still awake as we have this last session before lunch. By way of introduction, my name is Chanda Chungu. I'm based largely at the University of Zambia, but also part of the Secretariat for this particular conference. It's a pleasure and honor to be in your midst. So now we are moving on to the poster presentations. Unfortunately, we are rather limited on time. So I'd like to just alert the presenters that I'll be giving you roughly 4 minutes and 20 seconds precisely to ensure that we've got adequate time for questions and also to facilitate our exit to lunch. I will tap or make a noise to alert you when you've got 1 minute left in relation to the same. So we've got 2 presentations. The first presentation will be by Ms. Christina Mdemu, an advocate from Tanzania with professional experience in child protection program, together with Ms. Vailet Mollel, the UNICEF child protection specialist, and Mr. Martin Zuakulu, who's a senior research associate in innovations for property action in Tanzania. They'll be presenting a paper on social protection through social services, highlighting the importance of community-based systems in delivering social welfare and health systems. The second presentation is by Mr. Festo Singómbe and Ms. Christina Mdemu. Mr. Festo Singómbe is a social worker with 6 years experience focusing on child rights and youth protection. Their paper has a focus on refugees and refugee camps and how adequate protection and training can be given as a means to youth employment. So as mentioned, you may proceed to present and I will let you when you've got 1 minute left. So Ms. Christina Mdemu will be presenting the paper on behalf of the 3 colleagues. Thank you very much. You may proceed.
Good afternoon, colleagues. Greetings from Tanzania, Dar es Salaam in particular. It is Vailet who will be presenting, and we are together with Christine.
Good afternoon, everyone.
Good afternoon.
Yeah. Do you hear us? Do you hear us, please?
Yeah, I hear
Yes, we
you.
can.
Thank you. Thank you so much. Then I'm going to present. Yes?
Yes, please, you can go ahead. Please be aware that your time is running.
Okay. Do you hear us?
Yes, we can hear you. Can you hear?
Oh,
Can you hear
okay.
me? Yes.
Yes. Now now I can hear you.
Please be advised
you have
that you
just-
now have 3 minutes.
Yes, thank you. As we have just pointed out, I'm going to present on the importance of system strengthening programs in terms of achieving the social protection. And the issue here is in Tanzania, HIV is the leading cause of death, particularly among young people. And so far it is estimated 1.4 million adults are living with HIV and 2.3 million are children. And these children actually are orphaned due to AIDS. Tanzania only has 44% of the required human resources for health to be able to control the HIV epidemic, which is stand at least one social worker or 1 health expatriate per 20,000. And this is the data from WHO, which recommend at least the ratio of one health worker or social worker per 300 people. The community health system, health and social welfare system strengthening program is a government-supported program. It was being implemented by the John Snow Inc. This is an organization which is working under the support of the USAID, and it supported the program in 84 councils out of 184 councils in the country. The importance of this program was to strengthen the health and social welfare system to ensure that the Tanzanian most vulnerable and hard to reach citizens get the services they need in terms of HIV testing, treatment, and care, as well as other social services. And this program, in collaboration with the government of Tanzania, managed to develop an integrated national integrated case management system, which intend to manage care for people affected by HIV. But again, this system coordinates the efforts of state and non-state organizations who works with the children and their families across the health, protection, and social welfare sectors. The system is used by all community level actors, including the community case workers. These are the volunteers who are working at the community level, people living with HIV networks, as well as the violence against women and children protection committees. These are the structures that are found within the community with the intention of ensuring that the vulnerable children and their families receive services. This system also provides a framework for community actors to work together to identify, conduct need assessment, and as well as refer and link people to clinical HIV and community-based services. The system also improved the efficiency and the functioning of the community structures by empowering them to triage cases at the community level, because we understand the cases mostly began at the community level, but also providing the services for those services that are within their capacity to provide. But for those that are out of their capacity to provide, then they refer to other service providers for additional or professional services that are required. But again, these structures are responsible to follow up on the progress of the clients.
Sorry. I know you've got one slide left. This is the last slide. I'll give you 20 seconds to.
Thank you so much. So far, the lesson learned from this system, and we consider it as very important in terms of social protection, is that the community-based systems are key in delivering health and social welfare services to the vulnerable population and enhance the hope in attaining their potentials in life. Again, it is sustainable, it is cost-effective approach, and it uses community volunteers in providing services, which is very key for sustainability and ownership. And also, there are now more cases identified by these volunteers at the community and also referred to service providers. So in short, that is what I can say regarding the importance of this system in attaining the social protection. Thank you.
Thank you very much. Mr. Festo Singómbe, are you on the line? Are you ready to?
I'm online. Hello.
Yes. Yes, please, you can proceed. I will give you the same amount of time, which is 4 minutes and 20 seconds.
Yeah.
You may proceed.
Okay, thank you.
Sorry for the time hindrance.
Sure.
Thank you so
much. Hello,
good
afternoon to you. Good afternoon to you.
Good afternoon.
Yeah, I'm here. I'm Festo Singómbe from Tanzania, working with the IRC with the International Rescue Committee in Tanzania. I'm here to present my poster, which states that skills-based training as a means for youth employment. Hello.
We can hear you.
I'm proceeding. Yeah, I'm here to presenting some concern here. Yeah, the issue is that limited skills-based training. When we talk about skills-based training, it means vocational skills training. Yeah, we're using skills-based due to some restriction of government in working in refugee camps. So limited skills-based training in the refugee camp is a key barriers to youth access employment in emergency setting and upon repatriation, resettlement, and the major concern to youth protection and development. Despite the international assistance program. Hello.
We are here,
Hello.
You can proceed. We are here, you can proceed.
Yeah, despite the international assistance program, vulnerable population affected by crisis, including youth, still have limited access to social protection and social services, while unemployment growing faster than the job created. Limited skills based on training in the refugee camp is a key barrier to the youth access employment in the emergency and upon repatriation. The International Rescue Committee, IRC, in collaboration with the government of Tanzania and the developing partners implementing various programs in Nyarugusu refugee camp, including youth protection and development interventions, focusing on skills and livelihood with the social protection component to create an enabling environment for youth to access employment in the camp, and the adolescent and the youth age 15 to 24 years are targeted with the basic financial, computer skills, tailoring and soap making using IRC curriculum, learn to earn. Yeah, the trainee are supported with the startup kit for those youth who complete life skills and the vocational skills-based training for 3 months and 6 months, competent for 6 months, short course, enable them set up small business to sustain their income, hence meet their basic needs and support their family to their families. The group are monitored for some months by trained community volunteer to ensure the business are sustaining impact. A total of 321 in bracket 107 female and 214 male youth participated in skills-based training from January 2020 to July 2021, and 40 in bracket 17 female and 23 male managed to set a small business on stationery and soap making and the tailoring in the camp challenge.
Sorry, do you mind if you skip, I think, to the penultimate slide? You've got a minute left and we just want to take a few questions. Yes, please.
Yeah, let's go. We give how many minutes?
Yes.
Yeah, let us focus it. I'm going quickly. A challenge. So the challenge which facing skills-based training in the camp, repatriation and resettlement lead to some youth drop out in skills-based training. So those youth who are enrolled in skills-based training, some when are in the process to repatriation and resettlement, they drop out from the skills-based training. Another challenge is lack of reliable market for the product they produce by youth refugee in the camp. Yeah, in the camp we have a limited of market. We don't have external market, so currently refugees are not allowed to move out to the camp. So it's still the challenge. It means the product they produce, they sell within the camp. And the income of the refugee is still low. Some product they cannot afford because the production cost is so more high than the market needs. Lack of exhibition opportunity outside the camp, and only exhibition done outside the camp involved refugee, it was in 2017. You see, there's no opportunity for exhibition. Some refugee youth who are implementing livelihood activities are not allowed to move out for exhibition. Exhibition only the last exhibition was done in 2017, where refugees will go outside the camp to share, display their product. Yeah, the lesson learned, skills-based training have been improved.
Okay. Sorry, sorry to stop you. I think we'll leave this slide on. I think you've mentioned fundamental topics, just we're constrained for time. You've mentioned on the startup kits, the reliable markets, and the other challenges such as exhibition. I would just ask that the last slide remains so that people can read, and then I'll open up for 1 or 2 questions. My sincerest apologies once again for this. Are there any questions on the 2 presentations on the community-based systems and the focus of youth employment in the refugee camps? Are there any questions or queries on these 2 poster presentations? Yes, please.
Thank you. To the presenters, I just want to find out whether we are not glorifying a system, like a community system, which has a potential of overburdening women, because they are the ones who have to do all these chores in addition to their normal chores in the home. And also, when we're talking about the volunteers, the so-called volunteers, are usually not paid, and these are women who are also struggling with COVID-19. They're also struggling generally in life, and we are maybe basically saying that they should take on more responsibilities. Thank you.
Ms. Mollel and Mr. Singómbe, I'll give you 1 minute each to respond.
Thank you. I'm sorry I couldn't hear the first part of her question well, but at least regarding the issue of women who are mostly considered to be taking the role of volunteers in regard to the effects of COVID-19, yes, I agree with her. It's really a challenge because most of these volunteers are women, it's true, and they are the people who are always expected to be also taking the role of taking care of the family from their very own families. But now they are being added with another role of following up with children and their families who are vulnerable. So it's really a challenge, but what we are trying to do is for Tanzania is also trying to check the situation of these volunteers, trying to make sure that they're also having some key potentials, like some opportunities to work with some programs that are within the community that require volunteers. Then those who are working with this system are given the opportunity to work within those government temporary opportunities so that they can get some sort of source of income to make them more stable and reduce their stress in terms of dealing with their own family stress, as well as other role of taking other families' issues. That's what I can respond in terms of the volunteers.
Thank you very much, Mr. Singómbe.
Yeah, okay, thank you. With the part on volunteer, yeah, it means we in the refugee camp we have some youth leaders who are working, who are volunteering. We are already trained on leadership, also on volunteerism. We are trained on volunteer. So as some part instead of COVID prevention, avoiding mass distancing, we're using a volunteer who makes some awareness in the host community, in the camp, in their communities, in the community. So we use them to simplify the work because they are living with them, are living with some of the youth who are graduated from skills-based training. So it's very easy to share a message. But also COVID-19, I totally agree, it is still a challenge with implementation skills-based training because some volunteer drop out because they're lacking some motivations, limited motivation. So they need some maybe to hire, but with some we advise them to continue volunteering. When there is opportunity of employment, we link them to other department and the other organization operating in a refugee camp to link them to be employed in other organization as incentive staffs. I think it is the end of my presentation. I think it is now.
Thank you very much. Unfortunately, we've exhausted our time. I'm told that we have to proceed to lunch and resume at 14 hours back here. I don't know if there are any other announcements. First of all, a hand of applause for the presenters as well. Thank you.
We'll be breaking for lunch now, and we will be coming back at 2. As is the tradition of the SASPEN conferences, we usually have a group photo just to remind us and preserve the memories of such engagements. So we will be having a picture after lunch. So if we can all be here by 2, or if we could all gather, should we meet here or meet that side? Because we're having the picture at the front outside. So probably we could all meet by the area where we had the tea break. Then we take the picture, then we quickly come back in. So at around 13:50, thereabout, the conference secretariat will give a reminder for all of us to meet there to ensure we're all there by 2. So thank you very much, and see you at 2. Enjoy your lunch. Thank you. There is a question about lunch. Lunch is being served here.